Congressman Paul Gosar, Republican of Arizona, with us right now. He's introduced a bill paving the way for this Obamacare repeal. Congressman, very good to have you. The numbers right now favor Republicans, obviously, in the House, 241 of you versus 194 Democrats. And you'd have to peel off a few of your colleagues, I guess, being considered either for cabinet positions or are sick or not available. So you can't afford to lose much more than 20 members on this thing. How does it look?
I think the measure will pass, Neil. But I think there's other things that can occur. And I think that if we're talking about market-based, building back up a market-based alternative, what we've got to do is be smart about that application. And that's why one of the things that I've introduced is taking back the monopoly and collusion rules, subjecting the medical insurance industry to the Sherman antitrust laws, putting more opportunities for the American public. And we tag team that with health savings accounts, you've got a really wonderful cocktail about what is possible. And that's hardly fathomable by elected officials and by bureaucrats. You know, they've actually taken us to a deathbed with our healthcare system. That's where we're at. We're trying to rescue this. And I think there's a golden opportunity to get this thing right. And that's one of the measures that I feel has to happen.
All right, but as you heard, sir, Nancy Pelosi has likened it to you and your colleagues inviting chaos because you'd be repealing it without replacing it. And that even was a bone of contention with the likes of Rand Paul, who said, wait a minute, we've got to do it simultaneously. Explain.
Well, but I think you do that with exactly the measure that I'm espousing. There's hardly an American or a patient in America today that actually understands that, you know, their medical insurance industry has not been looking out for them. And true competition in that marketplace breeds expertise and excellence and new ideas and opportunities. And when you facilitate money in people's pockets, there's amazing opportunities that you'll have. And so if you're going to do something like I'm proposing, you're actually building it as you're tearing it down, because the industry is going to actually show patients, here's an opportunity of saving money. Here's how it will cover you. This is the deductible that you'll put away and the health savings account that you start to control. And I think from that standpoint, we're resuscitating that patient and that application.
No, I understand what you're saying. Believe me, sir, I understand what you're saying. But the rap the Republicans have is there will be that gap, that interim. I know you're making some plans here to avoid, you know, just falling into this chasm. But they're going to say, well, wait a minute, you're taking away all the funding and the mechanism by which you sort of support this thing. And then you're left with nothing. You say what?
Now, see, I disagree that we're left with nothing because, you know, if you look back at health care, Neil, 10th Amendment rights are on both insurance and health care. I'm not scared about the incubators called states. And when we start working with states, there may be some states that want something like a single payer. Out in Arizona, that won't work. That's not an option that they would want. This is an opportunity to get it right, because if we go down this track, we're going to a single payer. That's the VA, Neil, and that's why I say we're rescuing this off the deathbed, because that's where it's taking America's patients and healthcare system.
All right, Congressman, thank you very, very much. I know you're going to have a crazy day ahead of you. We appreciate it.
Yeah.